Hello and welcome to Wellbeing on Spectrum Television, a program that is structured to encourage a healthy living. I am with Cyril. Please do well to follow us on all our socials at Spectrum TV or visit our website at spectrumtv.ng. Today's show promises to be super educating, so you might just want to grab, writing materials cause you wouldn't want to miss this very part. Trust me. In fact, it might interest you to know that there isn't been a great deal of data on oral health in Nigeria. However, available data reveals that dental crisis, that's tooth decay, affect about 23% of Nigerians, with about 90% of these cases going untreated, while gum diseases affect 15 to 58% of the population aged from 15 years and above, which is why we will be talking about dental care or oral hygiene on the show today. So we'll just go on a very quick break, and when we return, we'll dive into the topic of the day. Please stick around. Welcome back to the show. In case you're joining us, please do well to follow us on all our socials. Like I said, this is Wellbeing on Spectrum Television, reaching you from the beautiful hills of Ibiakuran. Before the break, we had just introduced the topic of the day, which was dental care. Now, don't forget that well-being is very important to you, not just you and your health, both psychologically, mentally, physically, and emotionally. And that's why it's always an exciting moment of health talks right here on the show. All right, so when we talk about good dental, health, when we talk about oral hygiene, what does it mean? Dental or oral health is actually concerned with your teeth, gums, and your mouth. So the goal is actually to prevent complications such as tooth decay, cavities, and gum diseases. And then it asks also to maintain the overall health of your mouth. So a healthy mouth is free of infections, injuries, and other problems with teeth and gums. And it's also important in maintaining your overall health. I mean, every part of your body is important. So if you're taking care of your eyes, you need to take care of your mouth. If you're taking care of your mouth, you need to take care of your body. They just work in pari passu, right? Although a different set of medical professionals, focuses on dental health, they are still part of your regular health team. So you need to be going for a checkup every other time. Now, disease and other conditions can affect your dental health, and dental problems can affect other parts of your body. So failing to properly care for your oral health may lead to other oral problems. So you can see that you really need to take care of yourself and go for proper checkups. So you can help prevent or minimize many oral health problems by regular preventive steps, which is brushing, flossing, and so on, and also a regular visit to a dental health professionals. Now, injuries to the mouth and teeth can cause problems to you, especially for young people, playing sports. So make sure that young and not so young, athletes, you use a proper fitted mouth guard when doing your sport, especially when playing contact sport or engaging in activities where it may likely fall or blow the mouth as possible, so you don't get to hit, have a direct contact with your tooth, which is very important. Dental health begins shortly after birth and continues till the rest of your life. Constant and consistent oral health habits comes from habits and patterns established as children under the direction of a parent. So now let's hear what Dr. Nina Pandey, who is actually a dentist, has to say about dental care. Please stick around.
Hello friends, greetings on World Oral Health Day. I am Dr. Neena Pandey, Senior Consultant Dental Surgeon, Kailash Hospital, Noida. Today I would like to appeal to everyone to take all preventive measures for a better oral health. As is said, prevention is better than cure. Same is true for oral health too. Steps to prevent tooth decay should be taken as early as when the first milk tooth erupts in a baby's mouth. Nursing bottle caries is a very common occurrence. This is due to the negligent feeding of babies. Babies are fed while they sleep off. This causes milk to remain in infant's mouth for a longer period of time, causing tooth decay. Ideally, the nipple should be removed and a sip of water should be given so that it washes down the last bit of milk present in the mouth and making the mouth clean. Infants' teeth should be brushed at least once a day with infant brush because a coating of milk occurs on the teeth, making them decayed. All parents should try to safeguard their children's teeth in natural form by taking all preventive measures. Habit formation occurs as early as childhood, so inculcate the habit of brushing twice a day from young age only. Also, do not encourage them with sticky sweets such as candies, chocolates, or cream biscuits. Even cold drinks and chips should be avoided. Rather, a habit of eating raw fruits and vegetables should be developed because they have a natural cleansing action on teeth. Friends, let us all take a step towards a healthier society as far as our oral health is concerned by visiting dentists twice a year for a preventive checkup so that any problem occurring in your mouth can be nipped in the bud. Scaling should essentially be taken at least once a year. Avoid eating pan masala, gutka, or tobacco in any form. Poor oral health not only affects enjoying of a food, but it also leads to low self-esteem. Sometimes it also affects our general body health. Hence, never ignore even slightest discomfort in your mouth by taking painkillers to subside it. Rather, visit a dentist at the earliest for corrective measures. Thank you.
You're welcome back. I'm sure you've heard what she had to say. I mean, it is not so difficult to brush like at least twice a day. So before you go to bed, don't hurry. Don't hurry. Make sure you brush your teeth before you go to bed. And then for people that eat very late, I don't know, you just need to do something. Develop a plan that will help you at least before going to bed. No matter how late or early you make sure you brush before going to bed. It is good. Also, good oral health practices and regular visit to dental health professionals will help you enjoy the benefit of bright smile and a pain-free mouth. You can see that, yeah. So if you begin a good oral health practices at an early age and stick with them through adulthood, the odds are good that you will have a healthy mouth, pleasant breath, strong teeth, and a bright. I cannot even start to stress the bright smile enough. And that's because, like people say, that you're never fully dressed without a smile. So, I mean, how do you get a smile when your teeth are not healthy and then you don't have a good breath? You might just see someone and you don't know how to say hello because you are trying to be very careful. So, try to brush at least twice a day to keep your, oral hygiene going, and then you keep your teeth very strong. Now let's continue. Even if you have to, let a dental problem develop over time, it is never too late to see a dental health professional for corrective procedures. So thanks to modern practices, much of the pain some people fear is gone from dental health procedures. So you don't need to be very scared about the pains anymore because there are things that will help minimize or reduce the pain drastically or completely. And then practicing good health, good dental health is important to maintaining a healthy mouth, teeth, and gums, and also helps your appearance and quality of life. Your dental health team consists of you and your health your dental health professionals. Together, you can prevent many dental problems from causing a diminished quality of life and potential medical complications. So you don't wait till you have those medical complications. Like they say, prevention is better than cure. But I wouldn't know why we prefer the cure over prevention that is actually cheaper than the cure. So you just have to do something today by visiting a hospital and getting yourself checked, not just your mouth. Remember, every part of your body is important, and that's what we do here on well-being. All right. So your health professionals actually include, let me introduce you to them. We have your dentist, and we have a dental hygienist. We have a dental specialist. We have a periodontist. A periodontist is actually a dentist who specializes in preventing, diagnosing, and treating gum disease. So they also help you manage signs of advancing gum problems like oral inflammation. Yes, we have something like oral inflammation. And then we have the orthodontist, a dentist who is qualified to treat irregularities in the teeth and the jaw. So those ones, surgeries might just be needed. And then we also have the oral and maxillofacial surgeons, and they are advanced specialists who diagnose and treat problems with bones and tissues of your jaw and lower face area. So they take care of the jaw and the lower face because diseased, crooked, or missing teeth or a misshapen jaw interfere with your speech. It can make chewing your food properly difficult and painful and lead to expensive corrective measures. Don't wait till that time. And then cavities are painful places on your teeth where decay has eaten through the enamel and exposed to tooth root. Hot or cold food or liquid can send a painful signal that something is wrong. So you need to watch out for those signs. And then cavities may not have any symptoms until after significant damage to the tooth. This is why regular visits to your dental professional are so important. And then early signs of tooth decay are easier to treat than advanced cases. I'm sure we talked about this before, so you don't need to wait till it gets worsened before you visit a dentist and get your tooth checked. And then you might just feel like I am very okay, nothing is wrong with me. I don't feel no pains on my gums, my teeth are healthy, I chew very well, I don't feel no cold or hot, sensation when taking things. See, just go and be sure. There's nothing wrong. There's no harm in just being sure that you're fine, right? Thanks to modern dental technology, treating tooth decay, especially in the early stages, is often only mildly uncomfortable and is worst. Sometimes medications that it numbs the area of the decay, eliminates the pains of feeling a cavity for most people. And then there are some complications. Another complications of poor oral health is gum disease, which can be mild in the initial stages but leads to more severe problems if not treated, if it is actually untreated. So, gum disease or periodontal disease may cause loss of teeth, infection, and other complications. These are some of the complications of not taking care of your oral hygiene. And then, in addition to complications for your teeth and gums, research has linked periodontal disease to other health problems, including heart complications, strokes, diabetes, complications, and respiratory issues. So, good dental health is a combination of proper daily maintenance, brushing and flossing, along with regular visit to your dental care professional. Now, before this time, people with crooked teeth, misaligned jaws, and other problems with their mouth can often benefit from orthodontic procedures such as braces or other techniques to correct the problems. You get to see the braces on people's teeth. They're actually trying to correct some dental problems. So next time when you see people like that, don't laugh at them. They are just trying to take care of their health. You might just want to do that for yourself too. So your dental health professional can help you decide how to address the problems. Braces the ones for adolescents only can help people of all ages correct problems with their teeth and jaws. Not only orthodontic procedures help your appearance, but they can also help improve chewing and proper digestion of food, along with some speech problems. So regular visit to your dental health professional can help you maintain healthy teeth, gums, and mouth. Now let's take a quick pause to help digest what we have learned so far, and then when we return, we'll focus on how to achieve a good dental care. Please don't go away. Yes, you're welcome back. We are still here on the show Wellbeing on Spectrum Television. I hope you're enjoying the show. And please do well to join us on this conversation on all our socials at Spectrum TV, and you drop your questions there and then we'll attend to them. Now let's look at a dental preventive care. Dental preventive care is number one, the key to look dental health is a partnership between you and your dental professionals. So each plays an important role in establishing and maintaining good dental health throughout your life. So it's not something you do once that you stop. Good dental health is important to maintaining a high pain-free quality life. And then sound teeth and gums and a healthy mouth contribute significantly to your overall well-being. So the steps to preventing dental health problems are fairly simple and straightforward. However, they require a commitment to a daily routine. This routine begins with infancy and continues with some modifications for the rest of your life. So you need to have a to-do list of your brushing routines. That's very important to stay healthy. So number one is brushing. When you brush your teeth twice a day, at least minimum or twice a day, it is the cornerstone of good dental health. Parents should begin when children are infant and continue the until the child is able to brush by themselves or by herself. Usually age 6 or so, many children require supervision to stay on the task with brushing. Even as adults, it can be very tasking sometimes trying to rush to eat and trying to go to bed without brushing. So you might just want to supervise your children, and also while teaching, make sure you are also the doer of what you're teaching. And then general guidelines for proper brushing. Let's go there. Is number one, use toothpaste that contains fluoride. Your dentist can actually recommend one that has fluoride for you. We wouldn't mention that here, right? So we have different toothpaste. So just go to your dentist and then they will recommend a better one for you that has that contains fluoride. And then much later on the show, we'll tell you what the advantages of fluoride. So hold the brush at a 45-degree angle to your teeth and gums. Gently brush with circular motion. Now, brush inner surfaces of teeth with same motion. Use the brush tip to brush inner surfaces of your upper and lower front teeth, and then use scrubbing motion on chewing surfaces. All right, and then brush your tongue and rinse your mouth very well. Make sure you brush your tongue, remember. And then we have flossing, and then clean. Flossing has to do with clean between one's teeth. There's this flossing material that people use, and then some persons, meanwhile, if you do not have money to get that one, you can use a very tiny thread, like, and just put it in between your teeth, and then you get to floss them and get those remains out of your mouth to keep your teeth very healthy. Then, like I said, flossing is clean between one's teeth, and dental flossing breaks up pleo pleo on the surfaces between your teeth and under your gums. So flossing once a day helps to remove the pleo and food particles missed when brushing. It is an important step in your dental hygiene program. Now, these are the general guidelines for proper flossing. Number one, use about 18 inches of floss wrapped around your middle finger. Hold the other end with your other hand. Work the floss between your teeth in an up and down motion, and make sure to floss the surface of both teeth. Also, floss below the gum line and floss every tooth. That is a lot of work, but it is very healthy, And then for people with bridges and braces or other dental fixtures, you may need a trader or other device to help and clean around those areas. Just ask your dental professional for instructions before doing some of the things, all right? And then your dentist or dental hygienist can help you with specific instructions on brushing, flossing, and other dental preventive care methods. And then your best defense against the spread of infections and other medical problems from your mouth to other parts of your body are good oral health practices. Now we have dental health and bad breath. Bad breath can be a source of anxiety and social embarrassment. It is especially troublesome since in most cases you can't tell if your breath is actually bad. Now that is where the problem is. So you are coming out with full confidence, you have a very wonderful white teeth, and you don't get to know you have a bad breath. That's why you need to visit a dentist, not just for your teeth or removal of your teeth or wearing braces. There are more to these things, remember. So the store shelves are full of products to make your breath fresh and clean. However, most people do not address the root causes of bad breath. That's the bad breath now, which is halitosis. Now, certain foods like garlic and onions, for example, contain strong oils that enter your bloodstream during digestion. So people can smell those oils on your breath. And other food that may be trapped between your teeth can attract the grow bacteria, which give off an odor. So you need to watch out for all those things, and then keep doing flossing. Remember flossing, using stuff to remove some dirt in between your teeth. A mouth with cavities or other dental or gum problems is a breeding ground for the bacteria that can cause bad breath. So your tongue surface can also trap bacteria, as do partial or full dentures. And then we have the dry mouth. A dry mouth is another source of bad breath. So if you sleep with your mouth open, maybe you have a runny nose, you will wake up with dry mouth and a bad morning breath. And a dry mouth can also result from a lower production of saliva. You can attest to that. And then smoking and tobacco use, in addition to its own foul odors, dries up your mouth and promotes bad breath. Promotion of bad breath. Tobacco, I told you, you're not our forefathers, so disengage. And then bad breath is most often the result of diet and poor dental hygiene. However, certain conditions and diseases can produce bad breath. For example, we talked about diabetes, and then some problems with your nose and throat, such as sinus infections and other health problems, can cause bad breath. And then your dentist may actually refer you to a medical doctor if this disease is suspected. Source of if any of the source of bad breath is suspected, your dentist will refer you. And now here is the good news. The treatment for bad breath is simple in most cases. Your dentist may warn you about eating certain spicy food, but good dental hygiene is usually and most preferably most successful solutions. So brushing after every meal with toothpaste and using a mouth rinse containing antibacterial properties. Ask your dentist or any professional or any of your dental professional for recommendation of that. Is actually an important part of solving bad breath issues. I hope you had a take home from today's show. Let's take a short break, and then when we return, I'll give you a health declaration and health tip for the week. Please stick around. Well, it's good to know you're still with us on the show. Remember, I did mention that our health declaration will be more often just so it can become part of us, and then we can be more intentional about our health. Now, put your right hand on your chest and then the other in the air, and then repeat after me. I affirm that I will always take precautionary measures to any practice that is unhealthy. I hope you said that right. Now, finally, our health tip for the week is brush your teeth with a toothpaste that contains fluoride at least twice a day. Now, fluoride protects teeth against decay by helping strengthen and developing enamel and slowing acid production of bacteria that are caused by plaque. So you have to be brushing your teeth 2 times a day, like I told you. At least that is going to help you. Thank you so much for staying with me today on Wellbeing on Spectrum Television. Till I see you next time again, I am Willie Material. It's a goodbye.